So I'm going to sit down now, and I'm really pleased to welcome Lucy from Health Watch, who is going to take us through, do a brief introduction, and then Joan Basu and Val Grossett, who did the research into the report. You have got a report in your delegate pack, and I particularly want to mention Holly Robson, who is the person who designed the layout of the report, which I think looks absolutely fantastic. So could you please welcome Lucy Davis, who's Chief Officer at Sheffield Health Watch.
Yeah, I'm bringing Val and Joan with you for safety. Hello, my name is Lucy Davis and I'm the Chief Officer of Health Watch Sheffield. First of all, I can't do this without acknowledging how amazing it is to be in a room with actual 3D people. This is the first time that I've done something like this since COVID, and it does feel quite amazing. So thank you all for coming and being part of this. I'm not going to take too much time. The people that you really need to hear from are Val and Joan, who did this piece of work. And then really importantly, we want to leave enough time to hear from you. We're going to have some discussions after this short presentation about this piece of work. But who is Health Watch and how did this bit of work come about? Well, for those of you who don't know us, Health Watch is an independent organisation. We're separate, independent from the council and from the NHS, but we are a statutory organisation. So the law says that every area has to have a health watch. And our role really is to raise up people's voices and try and ensure that people, ordinary citizens, have a role and a voice in influencing and improving the way health and social care services are delivered. So it's a big job. There's lots of people in Sheffield and there's lots of health and social care services. We couldn't pretend, and we wouldn't want to pretend, to be the voice of everyone. So a really important bit of the work we do is working with organisations, with people, to actually support them in having a voice. And as part of that, we have what we call our Speak Up grants. They're micro grants, small grants to organisations to help them do pieces of work around subjects that are important to them. And that's how this came about through our Speak Up grant programme. But going back a step, before this piece of work, we'd done a report on home care. So in 2019, Health Watch Sheffield did some focus groups and wrote a report that described what worked and what didn't work for people in relation to care and support that they were receiving at home. We reflected after the report that actually what we hadn't done, and we acknowledge this, we hadn't really drawn out and focused on the way in which different communities, different cultures, different ethnicities, different people in our city might experience support and have different needs around support. So this piece of work really is a small step to acknowledging that this is really a key part of any consideration of a service. And we'd like to say thank you to SATMA for doing this bit of work with us, because I think they've done an amazing job. Val and Joan did an amazing job. And I know that some people who took part in the report are here today. So biggest thank you of all to you for taking the time, sharing your experiences. And that's it. I think that's it. I'm going to hand over to Val and Joan.